Hi, Natasha.
Hi, everyone, and hi, Dr. Carr. So excited to be on this webinar with you. I think this is the best topic you could have ever suggested for the current circumstances we all find ourselves in. And every single day, I'm getting questions. What can I take for my immune system? What can I do for my immunity? Am I at high risk? So, you have covered a lot of that, but you have some absolutely fascinating information about something that no one is thinking or talking about right now. So I hate to give the title of the talk because it's going to sound like I gave the best bit away, but here it is. Hormones and immunity. Do they go hand in hand? Do they affect each other? I'm so excited to hear what you have to say.
Thank you, Natasha. That's wonderful. And I'm going to start with sharing a screen. And yes, of course, to answer your question, hormones and immune system go absolutely hand in hand. So that's just the two of us, our partners in crime. And so again, given this present state of the coronavirus pandemic, first and foremost, Natasha and I, we express our gratitude to all the people who are in the front line. And Dr. Iyer has been in the front line because she works in the ER. I have not been, and I can't even imagine what some of the things that many of you are going through. So a big, gratitude to all of you and all those people who are working, at high risk for the coronavirus. Anyway, moving ahead with our presentation today. So what are the things we already know about the coronavirus? So coronavirus is the virus and COVID-19 is the disease. Now we know that people who are older than 65 years of age, those who have high blood pressure, heart disease, diabetes, obesity, those who are smokers, and those who have chronic lung disease, they are at a higher risk. That does not mean that these diseases cause a coronavirus infection, but it's nothing uncommon, Natasha, right? Anyone who has diabetes, we know, is already at a high risk for any condition.
System compromised because of
Yeah.
glycation and all of the other issues that go on with diabetes. One thing I just wanted to clarify, when we have chronic lung disease listed, this would be things like asthma even. So
Mhm.
asthma, emphysema, chronic bronchitis, COPD as it's called, sarcoidosis. There's a host of diseases that affect the lung. If you have anything that's affecting your lungs, you should be isolating yourself and really restricting who your exposures. In fact, you should have none. So for all of this list of people, yes, thank you for such a comprehensive list. I noticed you have men there. why
Yes.
why do you think men made the list and women are excluded?
Oh, well, women are not excluded, but this is one thing, one piece of information that has become very evident recently, that both men and women are, of course, at risk of getting the disease. But what they found, and this is from papers from China, from Italy, all over the world, that men do worse than women when they have the COVID-19. So obviously, the first thing that people think of is hormones, but obviously men and women are different in many different ways. It's not just hormones. However, to stick to today's discussion, we're going to talk about hormones essentially, but the fact is women are not smaller men. And in relation to heart disease, we know that. So each and every cell in a woman's body, in my body, your body for a woman, has a different sex. And of course, it differs how it impacts the immune system besides all the other systems. So why is it that, men are at a higher risk? We don't have all the answers yet. But the most important question, which probably all of you want to know the answer to, is there a role of hormone therapy in prevention of this condition?
Well, before you move into that, can I just say my initial thought was, yes, men are babies. Have you ever seen a man with a flu and a woman with a flu? Like, really, they are babies. But jokes aside, yes, when I saw that and I saw the articles that you had referenced, I was really intrigued with how important hormones are. in immune system function. It's something that even I never think about mentioning to my patients. And today I saw patients this morning, and here we are talking about progesterone as a neurosteroid, and for your sleep and for your calm and to lower anxiety, and we don't make it anymore, and DHEA as your hormone of youth, and all the other benefits including immune system function. But never do I ever think to go into estrogen and testosterone as hormones that impact the immune system. And I'm obsessed with healthy aging. I'm obsessed with all of us living a healthy, longer life, because it's very possible today to live a long life. The question is, are you independent and free and able to do whatever you want, or are you in some care facility having your bum wiped and a lift lifting you, and somebody feeding you, and you're drooling and you don't know who you are and where you are and who's coming to see you? Because that's the reality, Dr. Carr. That's the reality. And so when I work with my patients, I'm talking to them about hormone balancing for healthy aging, for that physical stamina, that brain protection, the cardiovascular system protection. But I have to say to you, never once before have I said to patients, and yes, I'm giving you estrogen for a healthier immune system because of, as you run out of hormones, your immune system's wearing out. I go, yes, I'm giving you estrogen for your bones and your brain and your heart and your vagina and your bladder and your sexual function and all of those lovely things. But never does immune system come up. So let's hear you.
Oh, thank you. Yeah, as you rightly pointed out, with age, our hormone levels decline. So a lot of systems in the body go through the process of, aging, and the immune system is not immune to it. So definitely that matters as well. So the most important question, that if you are already on hormone therapy or you're thinking of starting hormone therapy, is, will hormone therapy protect you from the coronavirus infection? Now, the fact is, the coronavirus, this particular one, the SARS-CoV-2, coronaviruses have been around for a long time. There are some which are normally present in the body. Those are not the harmful ones. This particular one, the SARS-CoV-2, is a relatively new virus. So obviously, we don't have a lot of studies. So Dr. Iyer and I cannot tell you for sure that, yes, you need to start hormone therapy now. It will, build up your immunity and all that, because we don't have the studies.
But the general studies to do with hormones and how they impact the immune system, we have that data. So you can, by implication, present this information and have a fair amount of confidence that it's relevant.
Thank you. So we do have studies where they have looked at women who were on hormone therapy, and they were given the influenza vaccine, and their response to the vaccine was way better. Now, if any of you are interested in the references, just send us a message and I'll send that to you, because I had promised Dr. Iyer I'm not going to put up a lot of sciencey stuff on my charts, on my slides. So one is the influenza vaccine. Yes, when women were on hormones, their response to influenza vaccine was much better, which is protective for them. And the other thing is, again, hormone therapy and its actions on the different types of immune cells. So your immune system is extremely fancy and very, very complex. And sorry?
Sophisticated.
Highly sophisticated. Thank you, Natasha. I was missing that word. So obviously it has different actions on different types of cells. I'm not going into all of that, but most of the influences have been good. Again, not in relation to the COVID-19, because we don't know yet, but we will know, I'm sure, over a period of time. And the other big thing that Dr. Iyer and I want to stress upon is the type of hormone therapy and inflammation. So Natasha, would you just like to add a few words about what are the different types of hormone therapy, and what do they do to chronic inflammation?
I just saw a patient in follow-up recently, and she's on hormone therapy from a doctor in the United States, and he had her on oral estrogen.
Oh my God.
And progesterone. And so when I took over her care, I said, I absolutely will not prescribe oral estrogen. It goes against everything I know. And in my field, once you know something, you can't not do it anymore. And so oral estrogens and oral testosterone are very inflammatory. Dr. Carr, you can speak to the effects on the liver, but you asked me about inflammation. So, inflammation is a state we want to avoid. We want to have the lowest inflammation in our bodies because inflammation underlies all of the diseases of aging that we do not want, whether it's dementia, cancer, heart disease, diabetes, whatever you talk about, and you don't want to get it. Inflammation is lurking behind there somewhere, if you get it. So managing inflammation is key. Yes, diet, yes, gut health, yes, looking at your mouth and your oral health and all of these things, great. We have a process and a system we follow at the clinic. We look after lowering inflammation. However, when you take hormones by mouth, they are very inflammatory. They increase inflammation. In fact, oral estrogens increase your blood stickiness. I don't want to use the medical terms, as you know, Dr. Carr. I'm sorry, I'm not as academic as you are. But when I'm explaining it to patients, I say it makes your blood extra sticky, and sticky blood is not good because it'll clot, and that's where the heart attacks and the blood clots and the DVTs, deep vein thromboses, that's where they come from. So on that note, can you just quickly say what oral estrogen, so estrogen by mouth, pills, testosterone by mouth, pills, what do they do to the liver, and does that affect inflammation?
Oh, very big way. So again, Dr. Iyer and I have a much longer video on the different types of estrogen. So the estrogen that you will get as a prescription when you come to meet Dr. Iyer is what is called a transdermal. So it's applied on the skin, number one. And it's the 17-beta estradiol, which is the estrogen which your body makes. I'm sorry, Natasha, I can't make a simpler term for that. So that is what your body naturally makes versus the oral estrogens. Now, 17-beta estradiol is there orally as well. But because it goes through the liver, it increases clotting. And the other thing is, many of you are probably familiar with the old hormone therapy, which was a very different form of estrogen. In fact, we don't even want to call it estrogen. It was more like estrogen-like. It was from pregnant mare's urine, and it had a bunch of different things which are not what your body makes. So there's a huge difference. And I'm sure those of you who are already on hormone therapy with Dr. Iyer, you know the difference between the two. But if you want to know the finer details, I'd recommend you go and watch that long, it is somewhat long video, but the two are not the same. So when you read, sometimes articles will come out, hormone therapy related to high risk for heart disease. The devil is always in the details. So which hormone therapy is it? So the new hormone therapy is the 17-beta estradiol on the skin, and the progesterone part of it is very different now. So this is the oral micronized progesterone or the compounded progesterone, which is not a progestin, which is not a progestogen. So these differences, the words may seem very similar, but there's a world of difference in how they respond to how they react in your body. So progesterone is what your body makes versus progestagen or progestin, and there are a whole bunch of them. Medroxyprogesterone acetate is the commonest one. They are, again, very different ones. They increase your risk for heart disease. And MPA is actually one of the worst possible drugs I think we ever came across.
And it's still available. That blows my mind because I came out and it unequivocally showed that horses' urine derived estrogen. So it's bioidentical to a horse. It's not even human estrogen. And yet an animal estrogen in humans was safer than a synthetic progestin or progestogen. And to this day, it's still around. When they stopped the study early with those findings, they quit following these women. They took them off the drugs because they were dying way faster than they should, at a much higher complication rate, much higher devastating negative health effects, and the drug is still available. And guess what? People are still prescribing it. Doctors are still prescribing, yet it's unequivocal that the study proved that that was the danger, not the horse-derived estrogen going into a woman's body. So enough of that. Sorry, we're digressing.
I know, but then,
oral estrogen and progestogens and progestins are inflammatory to your body. Inflammation suppresses your immune system function. In the presence of inflammation in your body, your immune system does not work well. Its activity is diminished.
And more importantly, we know that those women who have high blood pressure, diabetes, heart disease, they are at a much higher risk for COVID-19. So yes, building your resilience with the right kind of hormone therapy, not oral estrogen and the progestin, which is again a tablet, but the progesterone that we are talking about is also given orally. It's not applied on the skin. And again, there are lots of nuances to that. But one of the biggest benefits, Natasha, you and I talk about it so often, is progesterone and sleep. So they did a comparison of the medroxyprogesterone acetate and the oral micronized progesterone. So progesterone and the synthetic one were compared. And in that comparison study, progesterone helped sleep a whole lot better. And how many of you have a problem with sleep? I'm one of them. I know, and Natasha, you and I have talked about, progesterone is probably one hormone we will never, ever go anywhere
Take
without.
almost anything away from me.
Yeah.
You could possibly take my vitamin B away from me. No, maybe not, but I would fight for that one. But there's so many things. You could take my wine away from me, and you know what a big deal that is. But I will not give up progesterone because I am so nice. My mood is so good. My sleep is so restorative. I have no anxiety with it. And all it is, it's a natural hormone that my body stopped making, and now I replace it in the most natural form possible. On that same topic of sleep and progesterone, we give it orally. So I want to clarify this. We do prescribe progesterone orally, not progestin or progestogen. Those are your synthetic hormones. The bioidentical progesterone, when taken by mouth, has metabolites that work on the brain, that work on your GABA receptors, that work on the sleep mechanism and help you get into a deep restorative sleep. You do not suffer from a sleeping pill deficiency. You don't have an Ambien deficiency. You don't have an Imovane deficiency. But after age 35, when you start losing sleep and you start getting anxious, you have a progesterone deficiency, and that's why we replace it. And that being said, why this line is on the slide is because we know that sleep is one of the highest priority things to focus on for a healthy immune system. I can't stress that enough. But just taking melatonin, for example, or just going to bed earlier, or just doing one thing may not get you restorative sleep. For many people, myself included, I need to take a certain blend of nutrients at night, including magnesium. I need to take my progesterone. I take multiple things that facilitate sleep, but progesterone is key because without progesterone, I cannot get into a deep sleep. My brain is just lightly buzzing. I hear every sound and everything. I just cannot sleep.
Thank you, Natasha, for bringing up sleep and progesterone. And the other interesting question you brought up is sleeping pills and sleep. So sleeping pills and sleep are actually not good friends because the type of sleep you get is not restorative, but more on that on another day. And I have a video on sleep that I've done recently. So just one sentence: sleep loss is devastating for your immune system. Now, there are two kinds of problems I understand. One is people who cannot fall asleep or stay asleep. That's a much deeper dive, and hormones come into a big thing in that. And the other is the type of people who think that, oh, I can live with 5 hours of sleep. And Natasha, I'm smiling because I know you were there once upon a time.
Oh, I used to say I'll sleep when I'm dead, right? I have so many things to do. And then you put the kids to bed and off you go. And, you try and get work done and ready for the next day. And then I used to plan meals and be cooking at 10 and 11 o'clock at night. And so, when we discovered Matthew Walker and all of the studies he's done, I have to tell you, I say everything else can go to heck, my sleep comes first,
Yep.
because there's nothing as health behaviors, years ago, and I'll just take a few seconds. Years ago, when I used to do media, and they'd say, Dr. Iyer, tell us what one thing is, could our viewers pay attention to? And I'd say, eat clean. And then, all that science on meditation and MBSR, and so mindfulness-based stress reduction and all those things started coming out. So then I do an interview and they'd say, Dr. Iyer, what one? And I go, you must meditate. It makes your brain grow. It restores your memory. It makes you smarter. It prevents dementia. It lowers your blood pressure. It boosts your immune system function. It prevents chronic disease. All of these benefits. You must meditate. And if you were torn between eating clean and meditating, I would go, okay, well then just meditate, but also try to eat as clean as you can, right? And that's what I used to say. And then all these sleep studies came out, and now I'm like, oh my gosh, okay, well, see, again, we have to evolve the message. And so now if you're fighting between sleep and meditation and exercise and eating clean, and there's this big struggle going on, you gotta let sleep win.
Yep. So sleep is primary. In fact, I call myself a sleep police or a sleep evangelist. I said, I won't be a food police, but I will happily be a sleep police.
Oh, and try getting kids to remember to go to sleep now when there's no school the next day, right?
Oh.
So for parents, one of the most important things you can do for your children is get them to sleep. And restorative sleep, an easy way to measure without wearables and data and devices and sleep studies, an easy way is, how happy are they? If they wake up and they're in a good mood and they're happy and they're carrying on with their day and they're pretty agreeable, they probably had a good sleep. If they wake up and they're not their usual happy, provided you have happy kids usually. But I know in my house, it's so easy to tell who had a good sleep and who didn't. It's how easy they get out of bed, how happy they are to get out of bed, and how easy to get along with they are in the mornings, and then their activity levels throughout the day. And it's the same thing for us. A lot of times you tell me that. You say, I don't need to look at my wearable. I don't need to look at my Aura ring. I don't need any of that. I woke up and I felt refreshed. I know I had a good sleep.
Yeah, thank you. So moving forward, so what is this interesting fact about men, hormones, and COVID-19? Now, this was again just one study that came out of Germany a few days ago, where they had collected blood from men who had COVID-19, and they measured the levels of different hormones in their blood. So what they found is that men who had lower testosterone, and these were again men of different age, a lot of them middle-aged, those who had lower testosterone, they did worse when dealing with COVID-19. And truthfully, for Dr. Iyer and me, we focus a lot not only in testosterone in men. Oh, the other interesting thing is there were few women in that study as well. What they found is women who had higher levels of testosterone did worse. So we always talk about hormonal balance. It's not about too much of one hormone and too little of another. Again, these are like, we still have a lot to find out. But what is interesting to me is, Natasha, and I'll let you explain that, the low testosterone in men and their metabolism, because that is again associated with the risk for diabetes. And every patient who comes to our office, be it men or women, they will get a testosterone levels checked, right? So Natasha, will you talk a little bit about the low testosterone in men and their metabolism and belly fat and diabetes and all of that?
So I'll tell you this, about 12 or 13 years ago, I'd have to double check, but androgel, which is male hormone replacement therapy that's pharmaceutically made and commercially available by prescription. And so the rep came by and she said, oh, I'd really like to introduce you to this medication called androgel. We highly recommend you prescribe it for men who are diabetic, and her usual sales presentation to get me to write more prescriptions. And I said, oh, that's very interesting. What is the dose and how many milligrams per gram and whatever. And so it turned out that for what I was prescribing as a compounded testosterone bioidentical. So androgel is bioidentical as well. But each patient would have to use 5 packages of gel, meaning they'd have to bath in it, and they'd be like swimming and sliding covered in gel, trying to get the right optimal dose for what I was prescribing, which brings me to 2 points. Okay, it's so complicated, Shabnam. But anyway, when you put something on your skin, you cannot measure it in blood tests. So when you're using a topical hormone like androgel or estrogel or estrodot or the ester patch or whatever it's called, and you check blood, what happens in the blood, Dr. Kar?
It will never show up in the blood, because the ideal test for any hormones applied to the skin is a saliva test. And Natasha, I think we'll run out of time to have to explain all of that, but just an important difference. If you're applying any hormones on the skin, blood levels will never tell you. So the sad thing,
and I tried patients,
the sad thing is you will end up getting a much higher dose of hormones than you actually need if you are being followed in blood levels and not a saliva test.
It changes all the time. They say that because of the way it's made and enters the bloodstream and the water soluble versus fat soluble components and all of that, the science is showing that you have about 3 seconds to check the blood if you want an accurate level. So I sent a patient every week at different times of the day because she refused to do a saliva test because it costs money, and she wanted to just know. And every single time she tested, the level was different, even though she was applying the same amount of hormone to the same areas. Everything else was consistent, except the blood levels were completely different. So for all of you patients who check off things on your lab rec that I give you, even though I didn't check it off, please stop it. I've seen that how many times, it comes back and there's a level for estrogen and testosterone. I'm like, I would never check because you're taking it. Oh, well, I checked it off for you. No. So topical versus oral and then testing, all different things. However, what the data is clear about is that what we know about men and women both is that as we age, we make less hormones. I always say to patients, you age because your hormone levels decline. Your hormone levels are not declining because you're aging. And we see this in patients who have high stress. When their hormones are out of whack, they have accelerated aging and their testosterone's low, their estrogen's out, so we know that it's all connected, aging and hormone decline. So when we restore hormone levels back to youthful levels, it's anti-aging. Right? Absolutely. Now, as testosterone lowers in men, they talk about grumpy old man syndrome. We tease about the beer belly syndrome. There's all kinds of names for this thing, right? But what happens is testosterone manages metabolism and anabolism. So anabolic hormones help build and repair muscle, bone, tissue. You'll find that as men lower their testosterone levels, they're more prone to injuries. They get affected more by exercise. So my dad right now, I can't mow the lawn anymore. I'm all achy and stiff and my body hurts. And I'm like, 1, you need to eat more protein, and 2, you need testosterone, right? So more than all of that, the lower levels of testosterone correlate to dysglycemia. Dysglycemia is the medical term for abnormal control and managing of the blood sugar levels between a certain tight difference range that your body requires for optimal health. So dysglycemia means your levels go outside of the normal range at times, and that has an impact on your immunity, your brain function, your brain cell, like too many things, right? So testosterone's dropping, you're not managing your blood sugar levels as an aging man. What happens is insulin changes, sugar levels are changing, you guys pile on the belly fat. And that's where we talk about beer gut, beer belly. It's that huge belly, but there's not a lot of fat to pinch on the outside, but there's a lot of fat on the inside. This is called visceral fat. Visceral fat is inflammatory, so back to inflammation, which also suppresses and ages the immune system. But visceral fat raises your risk for diabetes, heart disease, and every other disease that you don't want to have. It will kill you faster than if you didn't have it. So what we know is that testosterone levels in men decline in their 30s, and they start getting lower and lower and lower, so that by 60s and 70s, we're really seeing an increase in visceral fat storage. We're seeing an increase in dysglycemia and inflammation. So what we know is that when we rebalance testosterone safely and we monitor it, we will see an improvement in blood sugar level control, and we will see the ability to start getting rid of that belly fat.
Absolutely. And I think, Natasha, a few years ago, if I remember correctly, the Endocrine Society had recommended in their guidelines that every man who comes to you and is diagnosed with diabetes should get their testosterone levels checked. So testosterone, men, it's not just muscles, it is bones, it is brain, it is mood. And more importantly, when we talk about muscles, Natasha, one of the things I wanted to point out is because I have a lot of men patients in India. So as South Asians are thin outside, fat inside. So if you go just by the body weight, they're probably normal, normal, but they have belly fat. Or if you do a more sophisticated measurement of their muscle percentage, like I say, their pants are almost falling off, unfortunately, because what has happened is they've lost their muscle. And if you lose muscle, see, being insulin sensitive, that is the good thing, you're not pre-diabetic and all that, is directly related to how much muscle you have. So besides, the control of diabetes through, food and movement and everything, how much muscle you have will also decide not only your diabetes, also when we talk about, your long-term stability, fall prevention, all those things, they sound kind of, oh, it's like when you're in your 40s and 50s, it's not like, oh, it's not such a big deal, but then it is actually.
So strength, energy, stamina, endurance, never mind sex drive and sexual function. But now let's talk about the immune system. And what you're showing us is that men with low testosterone have a worse outcome with COVID, which means that, which implies that testosterone absolutely is instrumental in the immune system function as well.
Yeah.
Or maybe even in our resilience and our ability to repair, because we said it's an anabolic hormone. So another thought could be, and we'll have to look at the data, but my thinking is that if you're stronger and more resilient and able to repair and heal, it matters to how well you
sure.
disease.
Yeah, so another thing with men low testosterone and COVID-19, again, these are very few early papers, and they've just been, I think, three or 4 days the papers come out. One of the other things that many of you may have heard about is something called a cytokine storm in COVID-19. Again, big words. So cytokines are these inflammatory chemicals, and when a lot of them are released in COVID-19, the outcome is poorer. But again, the most important question that Dr. Iyer and I cannot answer is, will adding testosterone hormone as a treatment during a COVID-19 treatment, is it going to help you? We don't know because we don't have the studies yet.
I would say to you that, I am like Peter Attia, how he has all these thoughts about studies, right?
Yeah.
and I would say to you, I know for sure it cannot hurt.
Yeah.
I don't know who's going to fund a study to prove that it's going to help the COVID-19 recovery and the immune system, because no one's going to make money out of that. But it just makes sense. It still stands that mostly young people are doing well with the virus. Young people have optimal hormone levels. They have the most optimal hormone levels. So it stands to reason that you can make that projection and say, if we restore our bodies back to youthful levels and function, we're going to handle any immune system assault better.
Just one point about young people. So if it is young people, but they have diseases, like they have excess body weight, they are pre-diabetic, they are, they have high blood pressure. They are just as much at risk for COVID-19.
That's right. And so thank you. That's why I said young, and so optimal hormone levels and optimal health.
Yeah.
Right? So thank you for the clarification, because that was my next point. The sad thing is that more and more young people have the physiology of old people. And I'm seeing it in our clinic, Shabnam. I've got 25 and 30-year-olds with hormone levels of 50-year-olds.
Oh, absolutely.
They look old. I saw a 21-year-old last week, and I honestly swear I thought she was 30. I couldn't even believe it when she told me her age. I was horrified.
Yeah.
So all of that external aging, can you only imagine what's happening internally?
Yeah, and this is the other very shocking thing, is because I was an OBGY before and dealing with, women with PCOS since many years in India. I didn't find as many of them coming with high blood pressure. These are young girls in their 20s and 30s. Now that trend has changed. A lot of younger people have hypertension, which is really concerning. Anyway, we are moving away from the immune system.
Right, but what it means is basically that now, when they're saying young people are not doing so well, no one is clarifying, is it a healthy young person with no comorbidities, or is it that healthy person eating McDonald's, having obesity, having asthma, having allergies, having hypertension, having all of these other things? Is that young person vaping? Is that young person smoking marijuana? Without all that information, and I just want to pause and focus on something. Make sure before you go hysterical about something, you have all the information, and that you think about everything. I'm seeing all sorts of reactions to this pandemic right now. For example, our chiropractor's back, and there's a few patients who refuse to leave their house to come and see her, even though they're in pain. And the point being, okay, if you have any of these diseases and comorbidities, as we call them, and you have medical concerns, absolutely stay at home. I can't stress that enough. If you have any illness, any autoimmune disease, stay home. Do not expose yourself to other people. But me, for example, fine, I work in the emergency room, and I have a choice, but I choose to keep working. I'm not afraid of this. And I'm healthy. I haven't had a cough, cold, or runny nose in a long time. I can't remember when last I had one. I have energy. I keep going. I was teasing a physician friend yesterday was teasing me about my mitochondria, because I'd accidentally had caffeine the day before. And then I was up all night the night before. And so when I got out of bed in the morning, I felt like I'd been run over by a truck, because I didn't sleep one wink. But, I carried on with the day. And then, he was asking about, napping or whatever. And I said, no, I still got to go play soccer with my son. And he goes like, what kind of mitochondria do you have that you can keep doing all this but no sleep? Right? Now, sleep deprivation, of course, is going to impact your immunity. But generally what I'm saying is I function healthy. I live healthy. We do all the right things. So I'm not going to keep myself at home. My friend, on the other hand, has a child who's on prednisone. He's got a serious illness that requires him being on steroids. He cannot leave the house, but she has to be extra careful because she's coming home to him. So that's the decision making. To be in absolute hysteria and panic is going to suppress your immune system. Stress impacts your immune system negatively. It's one of the sleep and stress. You want to ruin your immune system? Just go without sleep, give up sleep, have crappy sleep, pardon my French, and have high stress and worry about everything and have uncontrollable anxiety. And you will absolutely get sick. Whether it's from COVID or not, you're going to get sick because your immune system is not going to cope with that.
Thank you. So this last one is about a very interesting estrogen patch and progesterone injections. This is being tested in men with COVID-19. The reports haven't come yet, but just something to maybe look
Isn't
forward.
that curious that they're trying female hormones in men?
And you won't believe, progesterone is like 100 milligram twice a day, I think, for 5
Oh my
days.
Lord.
Yeah.
That makes sense. But you know what's interesting? I'm curious about the data that will come out. Keep us posted, Dr.
Yeah,
Carr.
I know. It's very
Because
interesting.
as men are dropping their testosterone, they're increasing their estrogen levels.
Yeah.
And so if they're already in an estrogen dominant state and they're growing their man boobs and they've got all these other things, I'm wondering how augmenting estrogen could help them.
Yeah, but this is in the treatment area, so it's not going to be for very long. So I don't think it will be. We'll see when the results come out.
Very curious.
So going back to the summary, number one is if you are on hormone therapy, definitely stay on it. It is something that is going to build your resilience. It is not going to harm you if you. Number one, it's not going to increase your risk for COVID-19. More importantly, if you do develop the condition, if you are on estrogen on the skin and an oral micronized progesterone, that is key. You can remain on that and not increase your heart disease risk or any of that. But the other question is, should you start hormone therapy for prevention of COVID-19? That's
Yes,
difficult to answer.
yes. You want the data to say so. And I'm saying, if you're feeling old at all, if you're feeling older than you are, and you want to feel younger than you are, for goodness sake, start hormone replacement therapy, bioidentical, in a safe manner, with a doctor trained to do it right. And
Yes.
I'm going to say that I'm not necessarily saying, come see Dr. Carr and I, although I hope you do. But the point being, I just got a patient in the clinic 2-3 months ago, and he is on treatment from a doctor who's never done a saliva test, never done a metabolism test. I've got a patient right now in my private coaching program getting hormones from a GP, and she says she's got a bioidentical hormone practice. And I'm looking at the dosing, my eyeballs are rolling in my head going, what kind of dosing is this? But you can't say anything. I can say this out now because I can't say it to the patient, right? But this woman has never had hormone metabolites checked, hormone ratios checked, and all of this is so critical because it doesn't matter if it's bioidentical or not. It can still do bad things in you.
Yes.
Even if you're putting it on your skin, it can still be too much estrogen compared to the progesterone. Your estrogen might be converting into negative estrogen metabolites. Your testosterone could be converting into more estrogen and into more negative estrogen metabolites. How do you know? You think it's safe because a doctor wrote it. If you've never had a saliva test, if you've never had a steroid hormone metabolism test done, if you've never had a 24-hour urine collected, if you don't get regular blood work to look at markers to know what these hormones are doing in your body, it's being done wrong. So find a doctor who has that level of training and understanding that hormones are not just what you write. Shabnam was an obstetrician gynecologist for over 20 years. I did 8 years of obstetrics in Canada, plus a year of residency in obstetrics and gynecology, coincidentally. And we never tested levels. It's unbelievable that we were busy writing hormones, and worse, we were giving it by mouth, for goodness sake. And even today, people are on the birth control pill. What do you think that is? It's an oral estrogen and progestin,
Yeah.
and so you're taking all these things and you're not being monitored. That is not safe. So if that's the case, if you're going to go willy-nilly and take hormones, then don't bother. Don't do it because you think it's going to help you. Do it right, do it safe, and get the benefits. But if you're making negative hormone metabolites, you're a poor methylator, you're making you've got some kind of aberration in your genes. We talk about COMT, we talk about MTHFR, we talk about MTRR. These are all genetic things. When you don't know what those genes of yours are doing, how do you know that you're going to excrete these hormones safely and be healthier from it instead of sicker from it? How do you know you're not going to grow a breast or prostate cancer out of it, even though you're putting it on your skin, but nobody's checking you and monitoring you. So that's my rant for the day. I'm sorry. Yes, I said everybody should be on hormones. I believe that,
Yes.
but I also believe don't do it if you're not going to do it right.
Hormone, yes, absolutely, Natasha. I fully agree with you. I was just talking about in relation to COVID-19. There is probably no reason not to be on hormone therapy unless you've had some hormone-dependent cancer. That's a different story. So this is, again, not just the recommendation from me and Dr. Iyer. It's like the North American Menopause Society says women need to be on hormones. And after the WHI study came out, a big disservice was done to women by not giving them hormones. But Natasha, I've told you so many times, in India, in my 20 plus years as an OBGY, I have probably never written a hormone prescription, maybe just once, because the patient came to me with hot flashes and it was like she just couldn't help it. That is the only hormone prescription I wrote back then. Okay.
It's so crazy. Just yesterday, I was saying to a patient, just because you have hot flashes doesn't mean you need to increase estrogen.
Oh, yeah.
And there's a different patient who I followed up yesterday with, and I said the same thing to her a few weeks ago. And I said, increase your progesterone before you change estrogen, because we need to measure your levels. I said, too high estrogen and too low estrogen can give you hot flashes. Your level of cortisol and your adrenal function affects your hot flashes. Your level of progesterone affects your hot flashes. If you're taking testosterone and it becomes estrogen, it can affect your hot flashes. So, everybody assumes that the myths out there, or the old-fashioned teaching that you and I received in med school, you got a hot flash, take estrogen. If it doesn't work, double it. If it doesn't work, double it again. If that doesn't work, write her an antidepressant because she's crazy. Right? That was true story, because I worked in a menopause clinic at the Royal Alexandra Hospital in Edmonton. I, as a resident, worked that way and did those things. And mind you, I was already a physician for 8 or 9 years by then, and that was the level of my knowledge back then. So like I said, once you learn new things, you can't not know it. So I can't go back to that old way of doing things because I know better. And so I think all we're trying to do is teach you to know better, because you are your own health advocate. And you don't have to believe a word I say. You should believe everything Dr. Kar says, because she's very...
I could believe it 6 months down the line, Natasha.
And then that's the other thing, right? Like what we said a year ago is different now as the data evolves. And so if you're working with someone who's not keeping current with the data, you need to think again about who your service provider is. So wherever you are in the world, Dr. Kar and myself provide virtual consultations. We actually have patients in London and Peru and Houston and other parts of the US. We have patients all over Canada. And, we'd be happy to do a consultation with you at any point in time. Please feel free to contact either of us. Dr. Kar had our websites up there. I will put it in the post when we do this, but drkarmd.com, drkarmd.com. And my website is www.better, with the number 4, numerical 4, betterforlife.ca. An easier place to find me is newrulesforbetterliving.com. If you sign up there, you'll get newsletters, and then you will know how to get a hold of me. newrulesforbetterliving.com.
Thank you, Natasha. And again, I think some other day I'm going to talk about my story of writing hormones in India and how frustrating I felt recently. Anyway, that's for some other day. Okay, everybody, bye now. Stay safe, stay physically distant, clean hands, and clear brain. Bye.